Hello friends, I am Dr. Manju Sharma from Department of Pharmacology, Jamia Hamdard. Today we are going to discuss about drug absorption and transport. In this topic, I am going to introduce you to drug absorption and drug transport mechanism, the structure and physiology of cell membrane, active and passive transport, the summary of transport mechanism and drugs absorbed through them, factors affecting absorption of drugs. Then we will also discuss about the methods for delaying and facilitating absorption. And we will summarize various mechanisms of drug absorption from various non-invasive routes. Drug absorption. Drug absorption is defined as the process of movement of unchanged drug from the site of administration to the systemic circulation. It is the primary aspect of pharmacokinetics and is necessary to determine the required dose of drug, to determine the frequency and administration of the drug, to ascertain the duration of effective action of the drug, and to predict the onset of desired or undesired effect of the drugs. Dissolution rate and absorption of drug. The drug may be administered into the body in various dosage forms like tablets, capsules, powders, suspensions, emulsions and solutions, etc. The first requirement for absorption is the soluble state of the drug. Thus, if the drug is given in solid form like tablet, capsules, powder, etc., it has to be disintegrated and dissolved before absorption. The dissolution rate depends upon many factors: high intense agitation, low viscosity of solvent, saturation of solution, smaller particle size, and high solubility of the drugs are the factors that increase the dissolution rate. Esterification can also increase the dissolution rate. In addition to the above mentioned factors, tablet formulation factors like filters, binders, lubricants and compression pressure, etc. also affect the absorption of the drug. A large tablet disintegrates more quickly as compared to the highly compressed small tablet. Dissolution rate can also be influenced by gastric motility. Lower pH increases the dissolution rate of weak bases but decreases that of weak acids. Now, we will discuss about drug transportation. When a drug is in soluble state, it must pass through one or more biological membranes to be absorbed and distributed into the organs and tissues. Drug molecules can cross the cell membrane by various transport mechanisms. Such movement of drug across the membrane is called drug transport. Now, we will discuss about the structure and physiology of cell membrane. The cell membrane consists of two layers of phospholipids with proteins and sugar embedded in them. In addition to phospholipids, the lipid cholesterol is also present. The phospholipid molecules have a head which is electrically charged and hydrophilic and a tail which has no charge and hydrophobic. The phospholipid bilayer is arranged like a sandwich with the hydrophilic heads aligned on the outer surfaces of the membrane and the hydrophobic tails forming the central water repelling layer. These differences influence the transfer of substances across the membrane. There are membrane proteins that extend all the way through the membrane, providing channels that allow the passage of electrolytes and non-lipid soluble substances. These transmembrane proteins, they form channels that are filled with water and allow very small water-soluble ions to cross the membrane. Some are involved in pumps that transport substances across the membrane. In general, biomembrane acts like a semi-permeable barrier permitting rapid but limited passage of some compounds while restricting that of others. Now we will discuss about the mechanism of drug transport. The three broad categories of drug transport mechanism involved in absorption are transcellular or intracellular transport, paracellular or intercellular transport, and vesicular transport. Transcellular or intracellular transport is defined as a passage of drugs across the GI epithelium. It is the most common pathway for drug transport. Paracellular or intracellular transport is defined as the transport of drugs through the junctions between the GI epithelial cells. While vesicular transport is an energy dependent process but involves transport of substances within vesicles into the cell. The major transport mechanisms are passive diffusion, and filtration. Number 2, specialized transport, under which there is carrier mediated transport, facilitated diffusion and active transport. Then we have vesicular transport, which include phagocytosis and pinocytosis, then pore transport and ion pair formation. First, we'll discuss about passive transport. It is also known as downhill movement. Passive transport processes do not require energy other than that of molecular motion to pass through the lipid bilayer. It is the most important mechanism for majority of the drugs. Majority of drug, that means 90%, diffuses across the membrane in the direction of concentration gradient. There is no active role of membrane. Lipid soluble drug diffuse by dissolving in the lipoid matrix of the membrane. The characteristic of this transport, it do not require energy, it doesn't have any saturation, no carriers are involved, and it is not having any resisting competitive inhibition. Now, we'll discuss about passive diffusion. It is a transfer process in which drug molecules pass through a biological barrier from phases of higher concentration to the phase of lower concentration, that is, along the concentration gradient, without requiring any expenditure of energy by biological system. Non-ionized drugs that are non-electrolyte can diffuse passively across the biological barrier at a rate proportional to their lipid-water partition coefficient. Thus, drugs that are highly lipid soluble can diffuse rapidly, whereas those that are less lipid soluble will diffuse slowly. For weak electrolyte, that is partially ionized drug, the diffusion would occur and depend upon the degree of ionization of the drug, the pH of the surrounding environment, and lipid-water partition coefficient of the unassociated form. The weak electrolytes are either weakly acidic drugs, that is, which form salts with the bases. For example, phenytoin, pentobarbital sodium, sodium salicylate, sodium sulfadiazine, and potassium penicillin V. Then there may be weakly basic drugs, that is, which form salts with acid and are available as hydrochlorides or sulfates. Example of such drugs are morphine hydrochloride, amphetamine sulfate, atropine sulfate, ephedrine hydrochloride, and chloroquine phosphate. Since the rate of passive diffusion of any weak acid or a weak base depends on the degree of ionization, which in turn depend upon pH of the surrounding medium, a relationship exists between its dissociation constant, that is the pK of a drug, and pH of the environment and the extent of its ionization. This relationship is expressed by Henderson-Hasselbalch equation, which is expressed as pH is equal to pKa plus log A divided by HA, where pK is the negative logarithm of acid dissociation constant and A minus is the molar concentration of ionized drug, whereas HA is the molar concentration of unionized drug. Now, implication of Henderson-Hasselbalch equation. Acidic drugs like aspirin, phenytoin, barbiturates are absorbed largely unionized in stomach and absorbed faster, while basic drugs morphine, diazepam, amphetamine are absorbed faster in intestine. Acidic drugs are excreted faster in alkaline urine and are called urine alkalizer, while basic drugs are excreted faster in acidic urine and are called urine acidifier. Strong acidic and strongly basic drugs are quaternary ammonium compounds, remain predominantly ionized at all pH and are therefore poorly absorbed. Now, we'll discuss about filtration. The free or unbound drug of smaller molecular size can pass through the pores or spaces between the cells by process of filtration. It is purely physical process where the rate of filtration is proportional to the pressure gradient. This is an important mechanism for the drugs of a smaller molecular size. For example, urea, alcohol, glucose, which are filtered through glomerulus. Lipid insoluble drugs can cross if the molecular size is small. Majority of intestinal mucosa and RBCs have smaller pores and the drugs cannot cross. But capillaries have larger paracellular space and most drugs can filter through these. Now we'll discuss about the pore transport. It is also called as convective transport or bulk flow or filtration. The driving force for this process is hydrostatic pressure or osmotic difference across the membrane. The process is important in absorption of low molecular weight, low molecular size drugs. For example, urea, water and sugar. Now about carrier mediated transport, which is also known as facilitated diffusion. The mechanism is thought to involve a component of membrane called as a carrier that binds reversibly or non-covalently with the solute molecules to be transported. The carrier may be enzyme or some other component of the membrane. The transport process is a structural specific, that is, carrier have a specific affinity for the transfer of drugs of a specific chemical structure. The number of carriers is limited. This transport system operates down the concentration gradient, that is downhill transport, but at a much faster rate than by simple diffusion. The driving force is concentration gradient, hence it is passive diffusion and no energy expenditure is involved. Example of such transport is entry of glucose into the muscle and fat cell by glucose transporter, that is GLUT4, and also GI absorption of vitamin B12. Now we will talk about active transport or uphill transport. It is the process where materials are transported across the membrane against the concentration gradient. The drug is transported from a region of lower to higher concentration, that is against the concentration gradient, or uphill transport. It requires energy in form of ATP, sodium, potassium, iron, glucose and vitamins like niacin, pyridoxine, ascorbic acid are transported by this mechanism. Now we will talk about active concentrative transporters. There are two types of active transporters, primary active transporter and secondary active transporter. Primary active transporters generate energy themselves. For example, ATP hydrolysis, the process transfer one ion or molecule and in only one direction. Hence, it is called unipolar. For example, absorption of glucose. Secondary transporters utilize energy stored in voltage and ion gradients generated by primary active transporters. For example, sodium potassium ATPase. There are two types of secondary transporters, symporters and antiporters. Symporters are also known as co-transporters. The example of such co-transporters are sodium ion glucose symporter, while antiporters are exchangers. An example of such exchangers are sodium ion and hydrogen ion antiporters. In secondary active transport processes, there is no direct requirement of ATP, that is, it takes advantage of previously existing concentration gradient. The energy required in transporting an ion aid transport of another ion or molecule, that is co-transport, either in same direction or in opposite direction. So accordingly, the processes is further subdivided into symport and antiport. Symport involves in the movement of both molecules in the same direction, like sodium ion and glucose symporters uses the potential energy of sodium ion concentration gradient to move glucose against its concentration gradient. While in case of antiport, it involves the movement of molecules in the opposite direction, that is, expulsion of hydrogen ions using sodium ion gradients in the kidneys. Now we will discuss about transport in vesicles, which include endocytosis and exocytosis. Also, it is called as corpuscular and vesicular transport. It involves engulfing extracellular material within the segment of a cell membrane to form a saccule or a vesicle, which is then pinched off intracellularly. Only transport mechanism whereby a drug or compound does not have to be in aqueous solution in order to be absorbed. This includes two types of processes: phagocytosis, that is cell eating, and pinocytosis, that is cell drinking. Phagocytic uptake of macromolecules are shown in the figure as on the screen. Pinocytosis. Pinocytosis process involves in invagination of a part of cell membrane and trapping within the cell of a small vesicle containing extracellular constituents. The vesicle content can then be released within the cell or extruded from other side of the cell. This process is important in absorption of oil-soluble vitamins like A, D, E and K, vitamin B12 and in the uptake of nutrients like fats and starch. The summary of some important transport mechanisms and drugs absorbed through them are presented in the table shown on the screen. Now we'll discuss about the absorption of drug. Absorption is the transfer of a drug from its sites of administration to bloodstream. Most of the drugs are absorbed by the way of passive transfer. Intravenous administration has no absorption phase. Not only the fraction of administered dose that get absorbed, but also the rate of absorption is important. Now, we'll discuss about the relation between absorption of a drug and dissolution rate. The first requirement for absorption of a drug is the soluble state of a drug. If the drug is given in solid form, it has to be disintegrated and dissolved before absorption. The dissolution rates depend upon many factors like high temperature, intense agitation, low viscosity of the solvent, saturation of the solvent, smaller particle size, and high solubility of the drug. These all increases the dissolution rate. Esterification can also increase the dissolution rate. Tablet formulation factors like filters, binders, lubricants, and compression pressure also affect absorption of drug. A large tablet disintegrates more quickly as compared to highly compressed small tablet. Dissolution rate can also be influenced by gastric motility. Lower pH increases the dissolution rate of weak bases but decreases that of weak acids. Now, we'll discuss about various factors affecting the absorption of a drug. The one is pharmaceutical factors, in which we have physiochemical properties of the drug like drug solubility, dissolution rate, particle size and effective surface area, polymorphism, morphism, salt form of the drug, lipophilicity of the drug, pK of the drug, and gastrointestinal pH, drug stability, and stereochemical nature of the drug. The second type of factors are dosage related. They are dosage form characteristic and pharmaceutical ingredient. For example, disintegration time, dissolution time, manufacturing variables, pharmaceutical ingredients like excipient and adjuvants, nature and type of dosage form, product age and storage condition. Now, there are patient related factors like age, gastric emptying time, intestinal transit time, gastrointestinal pH, disease states, blood flow through GIT, gastrointestinal content other than drugs, food, fluid and GI content, then contact time with gastrointestinal mucosa, pre-systemic metabolism and route of administration also affect the drug absorption. Now we'll discuss about how the route of administration affect the drug transport. For example, topical route depends upon lipid solubility. Only lipid soluble drugs penetrate intact skin. Only few drugs are used therapeutically. For example, glyceryl trinitrate, hyoscine, fentanyl, nicotine, testosterone and estradiol. Organophosphorus compound, they produce systemic toxicity. While cornea is also permeable to lipid soluble drugs. Mucous membrane of mouth, rectum, vagina, etc. are also permeable to lipophilic drugs. In case of subcutaneous and intramuscular route, drugs directly reaches to the capillaries and the capillary endothelium finally reaches the circulation. It passes through large paracellular pores faster and more predictable than oral absorption. Exercise and heat also increases the absorption. Example, adrenaline decreases the absorption. Now, absorption via gastrointestinal tract, oral route, for example, mouth, stomach and intestine, colon. It depends upon the physical properties like physical state, lipids or water solubility. It also depends upon dosage form like particle size, disintegration time, dissolution time and formulation. It also depends upon certain physiological factors like ionization, pH effect, presence of food, presence of other agent. The rate of absorption is faster to the lowest. Sublingual is the fastest one, then rectal, then oral. The two sites of oral mucosal delivery drugs are the sublingual route. Here the drug is placed below the tongue and allowed to dissolve, and the buccal route where the medicament is placed between the cheek and the gum. As a general rule, drugs are better absorbed under fasting condition and the presence of food retards or prevent it. Now, we'll talk about the oral administration and first pass metabolism. Before the drug reaches the systemic circulation, the drug can be metabolized in the liver or intestine. As a result, the concentration of drug in systemic circulation will be reduced. Now, we'll discuss about the absorption via parenteral site. Except given intravenously, the drug has to cross biological membrane. The drug, when injected intravenously, is completely absorbed and rapidly distributed, while the drugs, when injected intramuscularly and subcutaneously, are absorbed by passive diffusion from the injection site into the plasma or limb. Absorption of drug from intramuscular injection is usually more rapid than subcutaneous site because of higher vascularity of the muscle. The extent of absorption from the highest to lowest is intravenous, then intramuscular, and then subcutaneous. However, the absorption from these sites is reduced in patient with circulatory failure or in whom tissue perfusion is decreased. Drugs, when injected intravenously, are completely absorbed and rapidly distributed. So, according to the rate of absorption, we have inhalational, sublingual, then rectal, then intramuscular, then subcutaneous, then oral and transdermal. The IV effect is immediate, sublingual effect is within 1 to 3 minutes, while perrectal effect will be produced within 40 to 60 minutes. Now, we'll discuss about the absorption via lungs. Lipid-soluble drugs, when given in, they are absorbed through lungs in a vaporized form, for example, journal anesthetic, or an aqueous solution like salbutamol, or as a spray of suspended particles like disodium chromoglycate are absorbed by simple diffusion from pulmonary epithelium and mucous membrane of trachea and lungs. Absorption is rapid because of the large surface area and high vascularity. First pass metabolism is also avoided. Now, the absorption via topical route, that is skin, mucous membrane, cornea. Majority of drugs applied topically are meant to exert their effect locally. So, the absorption of most drug through intact skin is poor and keratinized epithelium behave like a barrier to permeability. However, the underlying dermis is quite permeable to many lipid-soluble drugs and therefore significant absorption can occur if the skin is abraded. A transdermal application of some drugs like nitroglycerin, scopolamine and clonidine, and application of some drugs on the mucous membrane like oxytocin, vasopressin as a nasal spray enhances the systemic absorption mainly because of the thin and highly vascular absorbing surface. Ophthalmic drugs in form of drops or ointment are also absorbed through the cornea. Now there are various methods for delaying the absorption. Number 1, using an appropriate dosage form. The slow release dosage forms like retard tablets, for example potassium chloride retard tablet, diclofenac sodium sustained release tablet, spensules, for example iron formulation and isosorbide dinitrate spensules, depot injections, for example testosterone depot, flufenazine depot injection, subcutaneous implants like testosterone pellets are the some ways to obtain a slow but sustained release absorption of drug. The second method for delaying the absorption is changing the physical characteristic of the drug. Physical characteristic of some drug may also be changed to retard their absorption. For example, insulin zinc suspension. Then, depending upon the pH of the reaction, insulin can form fine amorphous zinc suspension that is semi-lente, which is relatively rapidly absorbed, or we can have cloudy zinc suspension that is ultra-lente, which is slowly absorbed. Depending upon the effect desired, each can be used separately or can also be mixed together to form a lente preparation which produces immediate but sustained effect. Similarly, procaine penicillin G is such a salt of penicillin which is only slightly soluble when injected as an aqueous suspension, and it is slowly absorbed and exert prolonged action. The third method to delay the absorption is adding a vasodilator drug or applying a tourniquet. The addition of vasodilator drugs like noradrenaline or adrenaline to a solution of local anesthetic, for example xylocaine, reduces the absorption of local anesthetic into the journal circulation. This prolongs the effect of local anesthetic agent and reduces the chances of systemic toxicity. Application of a tourniquet to arrest the blood flow followed by an intravenous injection of a local anesthetic below the tourniquet delays the systemic absorption but prolong the local anesthetic effect. Decreased peripheral blood flow in the condition of shock significantly reduces the rate of absorption of injected drugs. Now, we'll discuss about the methods to facilitate the drug absorption. The rate limiting factors in absorption from the injection sites are diffusion through the tissue, then removal of the drug through local blood flow by adding an enzyme which breaks down the intracellular matrix to the injection fluid that increases the rate of diffusion to the interstitial spaces and greatly speeds up the drug absorption. Similarly, the absorption from the site of injection may be increased by increasing the local blood flow and by applying hot fermentation or doing massage. Now, we can summarize all the mechanisms and the drugs absorbed from various non-invasive routes as presented in the table shown on the screen. In conclusions, absorption is the movement of drug from its site of administration into the systemic circulation, and there are various factors that influence the drug absorption. Except when given intravenously, the drug has to cross biological membrane. Then the movement of drug across the biological membrane is called as drug transport. Drugs are transported across the membrane by passive diffusion and by specialized transport. A drug might be absorbed by more than just one mechanism. For example, cardiac glycosides are absorbed both passively as well as by active transport. The transport mechanism also depends upon the site of drug administration. There are various methods which are used to delay and to facilitate the rate of absorption of drugs. Thank you.